In my talk on new treatments for psoriasis, we will be covering new topical therapies. And for the first time in decades, we actually have two approved topical therapies. One is roflumilast cream and the other is tapinarof cream, and they are very effective for psoriasis. In fact, they're equal in potency to class 2 topical steroids. They're fairly quick. They rapidly resolve the itching of psoriasis, and they also clear the lesions. But the most important thing is they're not steroids. So they're safe to use even in places where we wouldn't use steroids. For example, the groin, the face, intertriginous sites. So we have great data on those. They have very few side effects and work very well.
I'm Alexandra Gallant. I'm faculty at the Mount Sinai School of Medicine in New York. As Dr. Lebel shared, in our session, we reviewed our two novel nonsteroidal agents that are now approved for psoriasis, roflumilast and tapinarof. Some highlights from the data that we explored in a case-based discussion included our intratriginous data that was part of roflumilast's primary data set, showing high levels of efficacy at week 8 for intratriginous clearance. So we know it's safe for patients with the disease in our sensitive skin areas. Now we have tapinarof's phase 4 data also showing high levels of intratriginous efficacy. So super exciting to have this as tools that we can offer to our patients in the exam room. Similar to this, we also know that both drugs work very quickly against itch. We see itch reduction significant in the first 2 to 4 weeks of treatment, which really kind of changes the treatment paradigm for topicals for these patients. No longer necessary to reach for a high potency topical steroid. You can go right to monotherapy with one of our novel nonsteroidal agents. And last, we have inklings that patients from a maintenance perspective may have treatment-free periods in which they can maintain their treatment. We know with tapinarof, we have remittive data that's super exciting, showing truly off treatment maintenance of response, and with roflumilast also in a real world on and off treatment durability of response all the way to 1 year.